Hello, my name is Paul Correa. I'm one of the directors at Fiduciary Wealth. I have here with me my co-director, Matt Penfold, who's going to be talking about healthcare in Spain. So, Matt, give us an update on healthcare in Spain and what British nationals, UK nationals moving to Spain need to take into consideration.
Okay, thank you, Paul. So hopefully quite a short webinar from us today just regarding healthcare in Spain. And as Paul says, this is aimed at UK nationals relocating from the UK to Spain, maybe some who are already here. So when it comes to accessing healthcare in Spain, there are a few different options. Some are based on your circumstances. So firstly, just about the healthcare system in Spain, it is broadly similar to what we have in the UK. The UK, we have the NHS. Here we have the SNS in Spain, which is a public health scheme, which provides services free. When you have prescriptions, there is a kind of small charge for that, but the healthcare is free if you are in the healthcare system. I think that probably one of the main differences between the UK and Spain is when it comes to dental work. There's no kind of public dental. You have to pay kind of private, which I think is often the case now in the UK anyway. So if you can get into the healthcare system in Spain, great. It's a very good system. Brilliant doctors, brilliant nurses, great services. But that's if you are eligible. So there are a few different ways that you can get in. So if you are working in Spain or you're self-employed in Spain and you're paying social insurance contributions, then you are effectively paying for that entitlement. So you are doing so and you can then register for the healthcare. If you're looking to move to Spain and you need a visa to do that, you may have to take out private healthcare to do that. I have heard of instances of people applying for their visa when they go through that process in the UK, being able to demonstrate that they're eligible for an S1 and using that as part of their visa application. But there are also applications where they insist that you have private medical care. The S1, for those who don't know, the S1 is effectively where you built up your entitlement in the UK through your contributions. And the S1, you're effectively transferring your rights from the UK to Spain. So if you are a UK pensioner, you're in receipt of your UK state pension, there's a likely chance that you can apply for your S1 in the UK, and then you transfer your medical rights to Spain. If you're not able to do that, then of course, in the early stages, you will need to obtain private medical care, or you may want to do that anyway. Again, like in the UK and all countries, of course, it provides a slightly enhanced service, maybe less waiting times, things like that. If you are applying for your visa, or you're in Spain and you're interested in the kind of private medical cover, if you want to reach out to us and we can help you get a quote for that, more than happy to do so. The other option you have is if you've lived in Spain for over a year, you can join the public health insurance scheme via the Convenio Especial. And you may have to excuse my pronunciation there. And by that way, you pay a monthly fee to join the scheme. So this gives you access to the Spanish health system. But because you don't have eligibility for it, you can pay into this scheme. And it's a way of getting into the Spanish health system. It costs around 60 euros a month if you're under 65, 157 euros a month if you're 65 and over. So it's generally kind of cheaper than having private medical insurance. So that is an option, but you do have to have lived in Spain for over 1 year. To apply for the Spanish Health Service, you have to access it via your kind of local region, and you do so based on where you are living in Spain. So really, that's a kind of very kind of brief and quick summary of the healthcare in Spain. So yeah, it depends on your circumstances. I think one thing we can say with pretty much confidence is that if you are moving to Spain and you're concerned about that, so I know from my own personal experience that the healthcare service here is brilliant. Obviously, that will kind of range based where you are, and it's like any location. But I know a lot of people in the UK are concerned about the state of the NHS. Long waiting lines, queues in A&E, can't get appointments to see GPs, and purely from my own personal experience, that is far from that in Spain. There's access to it, and the service is very good. So you have your different options there. And it depends on your circumstances. A lot of people, from our experience, tend to want to, arrange private medical cover. Why they do their visa application, gets them through that. Then they're covered in the early stages, and then maybe you can look to do your S1 or join the public health service when you arrive in Spain. But that's a brief summary today for you about healthcare in Spain. If you are looking to move to Spain and you want to discuss this and many other things, then reach out to us, Fiduciary Wealth Management. I'll also add you'll be watching this video on our YouTube channel, so please subscribe. There's lots more videos coming in the new year. And we offer this content for free. So if you've got ideas on videos that you'd like us to do, drop us a comment on the YouTube and we'll see what we can do with that. But yeah, for now, that's my summary on healthcare. Paul, anything to add?
Share the videos.
Share the videos. That's another one. Yeah, share the videos. I missed that one up. So I'm sure going through this process, you would know other people who are doing that, or maybe you're living in Spain and you're trying to encourage your friends to join. So share the videos, allow them to reach out and have a wonderful conversation with Paul and I, and we take it from there. Perfect. Well, thanks for watching. We'll speak to some of you soon, and enjoy the rest of your day. Goodbye.